Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Welcome to rePROs Fight Back. Happy New Year, and I hope everybody had a wonderful holiday. Since this week's episode is coming out on New Year's Day, it seemed like the perfect time to do a year in review, kind of looking back at all the many things that have happened over the past year. So I couldn't think of a better person to talk to break that down than Jacqueline Ayers from Planned Parenthood. Jacqueline, hi, thanks for being here.
Hi, thank you so much for having me. And you're right, what an amazing time to look back at where we've come from.
Yeah, it was a little shocking. Like, a lot of things have happened, but looking back at kind of the full list, it was a lot.
Absolutely. The last 2 years have been an unrelentless attack from the Congress, from the administration. And I think now as we enter into 2019, we have some bright spots to look ahead to.
Yes. So I added that to the end because I figured that otherwise it'll be pretty negative. We need to focus on, one, looking forward, but two, there are some bright spots when we think about looking forward. So because there were so many attacks, we broke them down into types, which I think was super helpful. So first, one of the types of attacks was trying to block access to getting care at Planned Parenthood.
Yeah, I recall the beginning of the 115th Congress. Then Speaker Paul Ryan had said, hey, we're going to, one of our first acts will be to dismantle the Affordable Care Act and defund Planned Parenthood. They entered with a straight agenda and spent really all of 2017 attempting to do that and soundedly failed because so many people did speak out. And then in 2018, we saw more actions happen from the Trump administration's Health and Human Services Department, where they had encouraged states to try and defund Planned Parenthood, so-called, by preventing health centers from participating in the Medicaid program. So we saw state after state put forward waiver requests asking the administration to basically kick Planned Parenthood out and treat Planned Parenthood differently than any other healthcare provider by not allowing Planned Parenthood health centers to get reimbursements under the Medicaid program. So here we are, 2 years into the Trump-Pence administration, and we have yet to see the Congress be able to achieve that goal. And so far, we're still waiting to see what will happen with waivers from various states like Texas and South Carolina. And we know that they're going to continue to also try and push this in the courts, which we've seen many states try to do. So a lot has been accomplished, but that main agenda item of conservative and anti-reproductive health efforts have not gone away.
And I think it's really important to kind of flesh that out just a tiny bit, because I feel like people often hear we need to defund Planned Parenthood, and they don't really understand what that means. And I think you kind of gave a good flag to that, as it means that patients on Medicaid would not be able to go to Planned Parenthood as their provider. And I think people don't necessarily understand that that's what that means.
Yeah, if you're a low-income individual who relies on Medicaid to get your health care, you actually have a protection in the law that says you can go to your provider of choice. Any willing provider that participates in the program, the patient gets to decide. These mean-spirited efforts, both in Congress and from state laws, are really targeting and taking away the ability for low-income individuals to go to the healthcare provider of choice. If Planned Parenthood is your provider of choice, these unfair efforts would say you cannot get the healthcare provider, Planned Parenthood and health centers would not be able to get reimbursed. And so that means that people would lose access. We all know that individuals, if they can't find a provider or another provider, they, instead of traveling or going other places, what they'll do is ultimately just go without care. We saw this in 2017 when Congress tried it. We had a lot of information out there about what are the alternatives, where there are places people can go. I think one of the myths you frequently hear is just attend a community health center. You'll go and get your care at a community health center. And fortunately, there have been a lot of local community health centers across the country who stepped up to say, wait a minute, actually, we refer our patients to a Planned Parenthood health center to get the best accurate full range of FDA-approved methods of contraception, for expertise in reproductive health care, and even other providers have said, hey, we need Planned Parenthood health centers to participate so that the whole network for care really will work. And thankfully, they weren't able to do it in the Congress, and 2019, we know that their efforts have been completely stopped because of the outcome of the midterm elections.
I always found it funny, not in a really funny way, but in a you laugh so you don't cry kind of way, where they would release the lists of, hey, look, these are all the federally qualified providers that women can go to instead. And it's like a dentist, and I feel like Florida had one, and it was like a prison, and like
I've seen libraries on those lists.
Like, these are not places where you're going to go to get reproductive health care. Like, it boggles my mind when you would always see these lists called out for that.
Yeah, it is really ridiculous because it just shows how out of touch these elected officials are with how people live their lives, how they get health care. The reality is that most women of reproductive age are going to their OBGYN or a Planned Parenthood health center or other reproductive health care provider as their main source of health care. Because typically those are the places where you get a well woman exam, access to birth control, cervical cancer screenings, STI testing, and annually that's the kind of care that young women are most likely to seek. When politicians' answers to them is to attend a dentist or to go to a library, I think it just really shows that they're out of touch and that they don't really understand the reality of people's lives and how they need to get health care.
One other place where we saw attacks on blocking care at Planned Parenthood was with changes to Title X. You want to touch on that a little bit too?
Yeah, Title X is a 40-year-old federal program. It's the nation's only federal program really dedicated to birth control access and has been bipartisan. It's unfortunately not been fully funded for years and years, but it has been supported in the Congress and in the administration. And then, unfortunately, when we had the Trump-Pence administration entered, we saw in 2018 that they attempted to put forward a couple of things, a funding announcement that would have drastically changed the program, and also a regulation that would have said providers are not allowed to give full information to their patients, particularly about abortion. And this has been known and read about in the media a lot as the domestic gag rule. That's a regulation that we're still waiting to see could be finalized very early January 2019. This is essentially unfair and discriminatory. It would block providers from being able to give their full information to their patients about the best source of their care. We anticipate that this is exactly the kind of regulation that the new Congress, particularly a new House of Representatives that will be pro-reproductive health care, can speak out against, can take action against, and we're going to continue to need people to lift their voices up, just like they did in 2017. This is essentially a regulation for the Title X Family Planning Program that is targeted at reproductive health care providers that also provide abortion. And this regulation has said not only can you not give full information, it also would prevent healthcare providers from being located in the same entity where you provide family planning care and abortion care. This is a section of the regulation called physical separation. So it's really detailed and technical. Ultimately, what it would mean is the Trump-Pence administration is trying to drastically change the Title X Family Planning Program, and it would result in less people having access to care.
Yeah, and again, it's just trying to separate abortion from other health care.
Reminding that abortion is health care.
Right, exactly. And that abortion is health care, and it's part of reproductive health care. And trying to separate them is only harmful to women.
Absolutely. I just keep thinking about the fact that the reality of how women live their lives means that they need to be able to take care of the families and the children that they have. And also, if they need abortion, they have that ability to get the care they need to continue their education, continue working. This is really mean-spirited, and it's designed to discriminate against women and others who may need abortion care by separating it out, stigmatizing abortion, making it seem as though somehow all providers shouldn't provide information about this critical health care service. Really, this domestic gag rule, folks may be more familiar with it because we've seen it on the international scale for years and years. With the global gag, those are the kinds of policies that they're trying to bring here domestically. And if this rule goes into effect, I think we'll start immediately to see health centers impacted and patients' lives impacted.
Yeah, and that's when you really are starting to see a lot is things getting tested on the global space and then being brought back domestically, and a little bit both ways, right? Things that we're seeing them tried domestically are getting pushed out globally.
Really, it's been interesting to see that whether we're talking about access to reproductive health care here in the United States or abroad, the agenda is still the same. The Trump-Pence administration is looking at programs led by the Department of Health and Human Services, programs at the U.S. State Department, and they're applying these same tricks across the globe to gag people from getting full information, to try and censor people, and ultimately just push really what is a really unpopular agenda when you're talking to just the average people. But unfortunately, the politicians and the administrators who sit at these agencies in the Trump-Pence administration are too often really not driven by outcome and thinking about what it means for patient care. We know these anti-abortion, very conservative and hate groups that are behind these efforts are looking to spread these policies both in the U.S. and around the globe.
So that kind of leads us into the next kind of bucket of issues, which is basic attacks on the healthcare system. There have been a number of various attacks in that area, from having state work requirements on Medicaid, to the new finalized birth control rule, to the proposed public charge.
Yeah, thank you for lifting that up, because the rate at which in 2018 we saw new regulations coming out from the Department of Health and Human Services has been a lot to keep up with.
Yeah.
It's been a lot of being thrown at us all at one time, but really, as you said, it's under the same efforts, which is to dismantle healthcare. The Trump-Pence administration has given an indication out to states that they could drastically change their Medicaid program for the first time, requiring Medicaid work requirements. And the Medicaid program, we know 1 in 5 women actually rely on Medicaid as their source of health care. So these efforts stigmatize the working poor, making it seem as though the low-income individuals relying on these programs are not currently working, so putting misinformation out there about them, and also serve as barriers sometimes for people who are going to school, who have other things that they may be pursuing and not able to work the required hours that is being proposed in states all over the country. We've seen states putting up these efforts. But it's important for, I think, everybody to know these efforts to dismantle Medicaid are not just about the work requirements. Many of these same states are also saying that they would like to advance a rule where Planned Parenthood health centers could not be reimbursed. And so when you think about a state that has a work requirement that kicks certain providers out of the program, for the individuals living in those states, they just erected so many barriers that essentially healthcare access, even if you have coverage, being able to access and get the care you need could become impossible. And so, yeah, I mean, I think a lot of people know, and we saw in 2017, Medicaid as a very popular program. We saw people who came to the Capitol, who lined the Capitol to prevent Congress from dismantling that program. But unfortunately, not enough attention has been given to the fact that the Department of Health and Human Services is also trying to dismantle that program.
That's something you don't hear about as much, especially if you're not really tuned into kind of the healthcare sphere. like just living your average life, you probably wouldn't hear as much about it until it impacted your life.
Yeah, I'm from Kentucky, and this is a state where we've seen the governor try to impose work requirements thanks to good partners like the National Health Law Program. Their efforts made it stop and temporarily in the courts. But as the state has continued to push through, in just a matter of months in 2019, we'll see people who have relied on that program for years and years to get their care and now risk losing that care if low premiums and continued evidence of work, 20 to 35 hours a week of work has not been proven to the state. Too often, as you just said, if you're busy working and taking care of your family, all of the nuances of these regulations sometimes are complicated and don't make sense to people. And so, unfortunately, I think, and there have been a lot of analysis out there showing in states like my home state of Kentucky and other states where they're trying to pursue these efforts, like in Texas, we know that people are going to lose access to care. And a lot of the progress that we made after the Affordable Care Act, it really is going to be lost under the Trump-Pence administration. So we know that we need more of our repro fights back warriors and people who are speaking up and sharing information really to help make sure that people are getting to their elected officials to speak out.
I think one thing that has kind of been lost because there's always so much going on at the same time is the birth control rule getting finalized. You know, there was a lot of uproar when the temporary final rule was issued last year, but it kind of became final with kind of a whimper.
Yeah, for folks that may not have recalled, this feels like a lifetime ago now, January of 2018, we did see that there was a proposed rule to allow an entity to refuse health care for someone, in particularly refuse abortion care, transgendered health services, but also access to birth control, sterilization, or really any healthcare service that a healthcare provider disagrees with based on their religion. This rule that you're referring to would create really an expansive enforcement authority. And so what we know is that if a healthcare official, a doctor, someone you see disagrees with the healthcare service that you need, this rule would allow their religion to discriminate basically on the type of healthcare that you get. We, again, have seen the courts play a big role here. In 2018, we know that there were various birth control rules the Trump-Pence administration tried to put forward that two circuits actually stopped from it going into effect and had a nationwide ban. So that is good and in place. But we're also still waiting for even for these more expansive rules that would undo protections in the Affordable Care Act and would allow for religious refusal rules to take effect in a broad way. That could still happen in 2019. So we definitely need more people talking to their elected officials and also now starting to think about how do we get the next new administration who can start to undo some of these things. We know that this is really meant to be complicated. The fact that there have been multiple rules that attack birth control. They're trying to make it really hard for even some of the most informed advocates to stay up to speed with everything that's been happening. So really now more than ever, it's important to talk and have elected officials talking about why birth control matters.
Yeah, and I think, the religious refusals part of that was so expansive, and so many people just didn't know kind of the full scope of that. I think I talked about it on the show before. Somebody I'm really close to is actually the president of a local hospital. And I remember venting to her about when these rules were being proposed, about how expansive they were. And she just did not have a good grasp on that. And, you would think that some of these people in these positions might have had a better idea, but there was just so many complicated parts of it that people didn't necessarily know all the details.
our partners, Planned Parenthood, had over 200,000 people submit comments before the regulation could become final and start to take effect. But even that vast number of people taking comments and sending in their thoughts to the Department of Health and Human Services, there's still so little that's known about it. And here's why I think we're not seeing more attention to it is because the rule has now been final and should actually, its implementation date, the date at which it should start to take effect is later in January of 2019. So it's not until, unfortunately, I think people actually feel the results and the hardships of these regulations, when in fact people could be denied birth control and not know it's because their employer has decided not to cover the insurance that covers birth control. It's really unfortunate that somebody would have to go from having a no copay birth control to showing up at the pharmacy one day and then having to pay for the first time in years. It's not until we start to hear those stories of people speaking up are people, I think, going to take more attention to what all of this really means. And it's unfortunate that it has to take effect at all, but I do think that they're speaking out, sharing stories is going to be especially important. And even just using social media to share why birth control has made a difference in women's lives, and individuals who rely on birth control are able to continue their education and continue their employment opportunities, being able to plan and space their birth of their families really has contributed. I think one of the exciting moments that we're in right now is an incoming class of new women into the Congress. Many who are young women, many who are young moms, and all have, their own story of how being able to access reproductive health care and birth control has led them to this moment. So as bad as some of the impact of these rules can be, I do think that there's a lot of power in storytelling.
Absolutely. It's so important because I think a lot of people get to a place in their lives where they can forget how expensive birth control can be to people who can't afford it. I mean, I definitely remember a time right out of college, even with insurance, my birth control was going to be like $65 a month. And I really had to think about it. And there was definitely a time where I just couldn't make that choice, where I just chose to not use birth control. And, I was in a place where that was an okay decision for me, but not everybody can make that decision, and people shouldn't have to make that decision.
Yeah, absolutely. I can remember a former member of Congress, a woman member of Congress, saying her birth control story was trying to decide whether to afford the bus fare to get her son to daycare and herself to work, or to put out the money for that birth control so that she could continue to working to take care of the son that she had and prevent future births until she was ready. And it's one of the reasons that compelled her to come to Congress and be a member of Congress and talking about that real life impact. And it's one of the collective community successes of the Affordable Care Act, when we actually had no copay birth control pass under that law. This is exactly the kind of progress the Trump-Pence administration is trying to take away, not just the prescription birth control, but all 18 FDA-approved forms of birth control. And we know that long-acting reversible contraceptions could be up to $1,200 if you use certain types of IUDs. And so most people are not paying that out of pocket. That is going to be too much of a barrier. So it's really these protections, long fought for protections in the Affordable Care Act, that have to be continually talked about, shared, and why elected officials who are the incoming class of the 116th Congress were going to have to work to protect and push back against the Trump-Pence administration. The one bright spot, I guess I would say about everything we've been seeing, the regulations, all the things that have been coming out, is that at least for right now, we haven't lost completely all of that progress. The Affordable Care Act is still in place and is law of the land. Affordable birth control under the no copay birth control benefit does still, in fact, exist. Medicaid has not been completely dismantled yet. We know and talked a lot about all of the actions that they have taken and will continue to take to go after sexual and reproductive health and rights. But I believe in a lot of ways they haven't been successful because people have used their collective power and their voice to speak up.
And there's just one thing you want to make sure that we're clarifying, and that's the birth control part of the rule has finalized and will go into effect in January. But the more expansive kind of religious refusals part has not been finalized yet, right?
That's right. And we're awaiting a regulation, to be really technical, a 1557 regulation, which is a portion of the Affordable Care Act that would protect people from allowing religion to discriminate against their health care. We're still waiting for the Trump administration to put that regulation through. We've only seen it proposed at this point.
I think another thing that's really worth talking about that we're seeing both on the domestic side and on the international side is censorship and trying to prevent the State Department or Health and Human Services from using certain words around sexual and reproductive health.
Yeah, I think a lot of people did not pay attention to this because of the flurry of information that was coming. But with the Centers for Disease Control, and I know also over at the State Department and information shared with U.S. embassies around the world, we've seen attempts through internal memos at these federal agencies that would discourage the use of phrases like sexual and reproductive health care, trying to eliminate references to transgendered individuals. And essentially, you might stop and think, what would be the purpose of circulating a memo like that? Why are they trying to really censor the words of government employees who are working on these programs? And at its core, right, this is just about further stigmatizing, discriminating against individuals, and trying to create erasure, really, and trying to erase, again, the reality of people's lives, and the idea that the Centers for Disease Control would not be able to talk in scientific, evidence-based terms about sexual and reproductive health care is not, it's censorship, and it's also just really an attack on science. And so we at Planned Parenthood have been trying to bring more attention to this and are putting up on our trackingtrump.org is a website where we have been trying to capture all of these actions, make sure that we're sharing with our supporters, and they can read on there about all of these attempts. But we also have been using supportive members of Congress who are supportive of sexual and reproductive health care and rights, doing letters, asking for more information and clear oversight and accountability of these agencies. And that's going to be even really more important in 2019 as the House has taken back taken back by those who are supportive of sexual and reproductive health and rights. I hope this year we're going to see some oversight and investigations into how science really has been undermined by this administration.
Yeah, that's kind of one of my pet issues. I come from actually an environmental science background, so science is always like one of those things that when I just see all of these attacks just on kind of basic science, it just really fires me off.
Yeah, and there's so much of it happening. I mean, look at the Teen Pregnancy Prevention Program. This is a program that is now about 8-9 years old that has been funded to make sure that comprehensive sexuality education is available to young people. And unfortunately, the Trump-Pence administration has tried to even target a program like that with wrong science and not using evidence-based practices in those kinds of programs, and instead have tried to change those programs into what they are now calling sexual risk avoidance. We should not be mixed up or confused. No. That's the same old school abstinence only until marriage kinds of agenda that we saw in previous administrations, and just using a new dressed up name. And again, not based in science, not being inclusive of LGBTQ and young people, and having really standing on the side of making sure everybody has access to full information. That's another area where the courts have been really important because of the Trump-Pence administration's efforts to try to take evidence-based policies away from programs like the Teen Pregnancy Prevention Program and try to change it using regulations and funding announcements. We've seen courts step in and stop the Trump-Pence administration so far from being able to make those changes.
Yeah, I found, so the sexual risk avoidance language is definitely pulling from like public health and like how they would talk about disease control and things. So that was definitely something when I was at the American Public Health Association conference, and I was talking about on a panel presenting about our 50-state report card we do, was flagging that, you know, people really need to keep an eye on that because they are taking public health language to repackage the same terrible abstinence only and not using evidence-based programs to fight it.
It's really amazing to think about as a country, right? We've made a lot of progress in 30 years or so of reducing the number of young people who are facing pregnancy before they choose to, increasing the number of young people who have the full range of information and ability to access services if they choose to be sexually active. And now, unfortunately, because of misinformation, not making policy decisions based on the evidence of where we've come, as you said, using phrases that sound like they're public health but are just dressed up to mean abstinence only, it is really a sign that we could go backward. We could lose the kind of progress that has resulted in young people being more confident, more informed about their decisions for their health and bodies and wellness. And so we know that, again, I'm just really hopeful that this incoming Congress can be a place that, in the U.S. House of Representatives at least, will be a place where they can look through more oversight of the teen pregnancy prevention program, but also hopefully start to get our investments back on a track of where federal money attracts where the evidence and where science tells us to go.
So thinking about the abstinence only, it just makes me think kind of a theme that we keep pulling out is shame and stigma, like trying to increase shame and stigma around sexual and reproductive health, around comprehensive sex education. Yeah, that's so depressing.
Yeah, I mean, I do think that when you peel back all the layers, the details, the regulations, all the things that happened and were released in 2018, you're so correct that this is a clear agenda by the Trump-Pence administration to put forward shame, increase stigma, to not talk about sexual and reproductive health care and somehow stigmatize and not normalize that the sexuality, health, and education is about our daily lives for all of us. I think that it really is just a sign that this administration and the politicians who follow this sort of agenda needs to probably get out of Washington, meet more people on the ground. We know that whether you're a Republican or Democrat, parents all across the country want their young people to have access to evidence-based, accurate information. So, these attacks that we're seeing on evidence, on facts, whether it's, I think, in journalism, in healthcare, in the public health field, there are these key themes. And so I just keep coming back to, I think supporters of reproductive health care and rights and activists really have to take as much action as they can by sharing their stories, being active on social media, talking to elected officials, getting their communities engaged. And I am really impressed that the last 2 years we've not seen that waver. I mean, since the Women's March of 2017, I think we've seen increased activism and people wanting to really shine a light and put a mirror up to what's happening with this administration. So I have to be encouraged that kind of activism is going to continue and the pendulum will swing the other way, I think, hopefully.
I think so. And I think that leads perfectly into, so there was a lot of bad things that happened last year, tempered by the great response that people are having of fighting back and pushing back on these policies. So looking into next year, what's giving you hope? What's making you excited?
I want to go back just a second to 2018 wrap up, and I think we focused a lot on how much happened, and it felt like it was an oncoming release of regulations and votes and all of these fights we asked people to get involved in. At the end of the day, we did have some success, right? Not defunding Planned Parenthood, not the dismantling of the Affordable Care Act, by pushing back against regulations. And I still hope those that are not yet final, like the domestic gag, are ones that we will see a rapid response and pushback to. We know that in 2018, more people stood up for victims of sexual assault and harassment when we saw people get involved in the confirmation battle around Justice Kavanaugh's confirmation to the Supreme Court. That energy, the mobilization of people who were willing to come out, fight after fight after fight, really is, I think, what can carry us forward. And one of the things that I'm thinking, that I'm really hopeful about is that, later this month, we'll see another women's march all across the country. January 19th, people will be marching. And I think also they're ready to march and act, and not just show up on that first day, but keep their communities engaged. And I know it may seem early, but I think it also means that people are going to be thinking about the next presidential election very early, probably earlier than ever before. We said in January 2019, people are ready to think about 2020. And I think there's some real possibilities of making policy changes that would really impact and protect sexual and reproductive health care. I think the more light we continue to shine on all these actions, all the work that activists and supporters are doing around the country, the incoming class of the 116th Congress and the House doing oversight, asking the right questions, all of that energy, I think, is going to fuel us to what I'm hopeful for, which is 2021 being able to actually roll back some of all of the mess that we've seen these last couple years.
Great. And I always like to end with what can people do to fight back? So thinking in the new year, what can people do? I know people have been doing so much already. Is there anything new they should be doing or different, or just keep calling your congressperson?
Yeah, I know my organizing friends feel like, oh my gosh, how can I make another phone call? How can I make another phone call? So I will say two things that I think people can do. One is, please know that your calls do matter when you're talking to elected officials. There is someone's job, who it is in that office, to count the number of phone calls coming in and to report that to the elected official on a daily basis. So I know that it seems like every fight, every action, Planned Parenthood and all of our coalition partners, it seems like one thing that we ask activists and supporters to do is to call. And that's because it does make a difference. So get ready to continue ringing the phone lines in 2019. And then I would say, most importantly, is people should get connected locally. We've seen a lot of change happen at I focused a lot on federal elections and the outcome of the midterms, bringing in the first pro-reproductive health majority to the U.S. House, but there have been a lot of changes at the state and local level as well. And so I would encourage for folks to get involved with Planned Parenthood Action Fund's Defender program. This is Planned Parenthood Defenders is a program that you can organize yourself and your friends and your community, and everything from fundraisers to local getting together to crochet together, to getting together to take actions, to do local marches, to do canvassing events. We really have been energized by people who are organizing themselves rather than any one organization. These are people who are finding like-minded folks in their communities and staying connected. And I think that is really opportunity to hear what the issues are locally, what people are most concerned about on a local level. And that's where you can make sure that your call or your request to elected officials touches not just your member of Congress, but really everybody at the local and state level. I think we are going to have an increased number of state battles every state legislative session. Many are coming back into session this month. And so we're going to really need a lot of mobility and people turned out at the state level. And a lot happens in Washington, but not everything happens in Washington.
Yeah, I think that's so important. It's something we've seen. I know I mentioned before that Population Institute does a 50-state report card on reproductive health and rights. And that's where a lot of the policies are happening, particularly around access to abortion. So it's so important to stay engaged in your local and state politics.
Yeah, I think that these state legislative sessions that are coming up, we're going to see an increased attack on access to abortion. We know that with the U.S. House no longer being controlled by those who are anti-abortion, a lot of the advocacy and rhetoric that we've seen from anti-abortion organizations, what they regularly share online is that they're going to take these fights to the states. Susan B. Anthony's list just came out last week saying that because Congress didn't defund Planned Parenthood, we'll go piece by piece, state by state. So they're laying out their roadmap, and they need to be met in states by advocates who are ready and there to push back and really start thinking about how to hold elected officials at the state level accountable to prevent any of those awful abortion bans from becoming law.
Jacqueline, thank you so much for doing this.
Oh, thank you. 2019 is going to be great.
Yes. For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.